thanks for tuning in. I hope you're feeling refreshed and maybe even had a chance to watch the video that we were showing during the break, sent in from clubhouses around Europe. And over the next hour, we're going to hear some different scenarios for mental health in the coming months and years.
Yes, Mindy. We are going to hear three really important speakers. Jan Bersen, our President of Mental Health Europe, Afzal Yaved, President of the World Psychiatric Association, and Pauli Loya, Clubhouse Europe board member. And it's the first time for a conference like our that we open to other association and partners to come over and tell us about how they see the psychiatric scenarios. And I hope to hear also how they see Clubhouse from outside. This is really interesting for us. Thank you.
Thank you. As Guido... Thank you. So as Guido has said, we have three speakers offering different perspectives of developments in and challenges for mental health. I'd like you to say hello. We certainly have Afzal and Jan in video. Thank you. Nice to see you there. And directly after each speech, there will be a chance for you to ask your questions to the panelists. It's very easy to send in questions. Please use the chat. So this time we do encourage you to use it. And please don't wait until they finish to send them in. Send them in as they occur to you so that we have plenty ready lined up and we can use the time properly. So we're going to start with Jan Bersen from Mental Health Europe, a Brussels-based lobby organization advocating for the best mental health in Europe. He's been working in mental health for over 30 years and is also CEO of Lista Utrecht, a regional institution for protective and assisted living in the Netherlands. Ladies and gentlemen, I now give you Jan Bersen.
Okay, good morning to all. I'm very honored to be a guest in your event, and Guido, you told me this is the first time you invited guests from outside, so I'm really very honored, and it's good to know that Clubhouse was one of the first members of Mental Health Europe, and Clubhouse Finland, and I think they were part of the they are part of the group who started Mental Health Europe in 35 years ago. So there is a strong connection between Mental Health Europe and Clubhouse, at least for Europe. So I want to share a presentation. I'm going to try it now. Welcome for the presentation of Mental Health Europe. I'm the president for now 2.5 years, and we are very active NGO in Brussels, and I'm delighted to speak to you. And I think we have to explain who we are, and we are promoting positive mental health and well-being, prevent mental health problems, and support and advance the rights of people with mental ill health or psychosocial disabilities. And you see 35 years of advocacy. More than 30 European countries are members of Mental Health Europe, and more than 70 member organizations. What we do is to make sure that positive mental health and well-being are given a high priority in the political spectrum. And I think it's a sort of shame that we have to do this for all these years, and but it's necessary. It's very necessary, and it's strange that we pay a lot of attention to physical health, all the hospital care, and it's still necessary that we have to ask for attention for mental health problems, and that's so we have to go on. Our focus is the recovery-based community mental health services, and we do it from more the focus on the human rights, And I think that's the reason that Mental Health Europe started this organization 35 years ago. It was also based on the model of Italy, of the law 180, was also based on human rights. So I think that's the main focus of Mental Health Europe. We have to take care of the human rights for all people, and in our situation for people with mental health problems. So that's I don't go to speak for all our things we are doing, but I think very important is the recovery community-based services, especially for you as Clubhouse in Europe and international, because you are in the society. So it's very important to pay attention to people with almost long-term mental health problems, but they need to get people in the neighborhood they can talk about hope and a new perspective and all things for the next step in their life. And it's also important to pay attention to empowerment and another thing I think very important for you as Clubhouse is mental health and work, because that's I think one of the basic points in your work. So we are really a European actor, and we are working strongly together with the European Commission. About 80% of our budget is from the European Commission, the European Union, and so that's the way how we can involve the decisions on the European level about mental health. We're strongly working together with the World Health Organization, and so we fight together with them for the quality rights they made up a few years ago, and there's also a connection with the Council of Europe. So that's the way how we can be involved in the political system, and that's I think the only way, the best way is to get in touch with the European Parliament. And so there are about 10-15 members of the Parliament who are connected with Mental Health Europe, and we can ask them for webinars, for events, but they ask us to look after new legislations, new laws, anything. So there is a strong connection between Mental Health Europe and the members of Parliament. So we are very proud to have a very broad membership, and it's users and ex-users of mental health services, families, carers, national, regional and local mental health associations, umbrella organizations, for example, service providers, professional bodies, research institutes, and a lot of individuals who are really interested in the world of mental health and well-being. So the profit for Clubhouses as a member of Mental Health Europe is you will be a partner in a European-wide network, and on this moment, Clubhouse Europe is a member, and that's the way how our contact is now based on. But there is a possibility that perhaps you will become member from your own region, because you can get more attention for the problems in your own region, and not for all over Europe, but more for Eastern Europe, Western Europe, Scandinavia. So that's the way you can decide. Perhaps that you. I'm not sure about how far you are in your developing in thinking in working together in Europe, but there are possibilities to work strongly together with us on a regional base. It's a network for professionals and client and members. Is a strong connection with European policymakers you can share knowledge with us, you can make friends with us, and with all the members. We are organizing a lot of events, webinars, and till last year also meetings in one of the European cities. And very important, I think, for you as well, you can learn about peer expertise. And it's the expertise for how you can involve people with lived experience in your own organization. How can you give the position they need? And it's also not only for the peers, but it's also important to learn for directors of clubhouses to use this very important expertise. And last but not least, it's good to know that our work is what I told you, is based on the human right, and it's in this case the CRPD. And if your country has ratified this convention, you can claim the rights, and it's another perspective. It's not only to fight for, but if your country has ratified this convention, you can claim the rights, and that's another way of thinking, of advocating. So clubhouses in Europe, I think your special places, you are in the middle of the neighborhood. So not far away from in the woods or in big hospitals, you are situated in the middle of the neighborhood. The European policy now is community mental health for all. So that's close to also your position in the society. You have wonderful facilities, and they are not in a medical environment. One of your tasks is to strengthen the position of your clients. And of course, we all know having a job is the best care. And important for me to say is that Mental Health Europe and all the members are very active in the way of thinking that nothing about us without us. So that's my short presentation. And so if there are questions, and you can also look to our website, Mental Health Europe in Brussels. And so with this, I think it's now time for... Okay.
Thank you very much, Jan. It was a very interesting presentation. As you know, Clubhouse Europe approaches to the concept of European countries in a wider approach than the European Community 28 countries. We approach, as the WHO and the UN says, that compare it's 53 countries in Europe, so we involve also all the Russian areas and all Belarus and Turkey. It's a wider approach, and this is, I think, a one step ahead to the other countries. And now, Mindy, how we are going to proceed?
Well, we already have a question come in from the chat from Vanda. Thank you. And the question for Jan is, what is the best way for clubhouses to relate with other mental health organizations? Interesting.
Okay. According to the policy of the European Commission, but also according to the policy of a lot of governments, the hospitals have the sort of, they have to look outside their own walls. And so I think when a hospital is looking outside the walls, they have to meet you. And so I think it's important that you bring your offer from Clubhouse on a very good attention to directors of mental health hospitals, or other mental health professionals, and I think you are in a sort of shadow at the moment, and I think you really deserve, your right is to get a better place in mental health care. But you have to present yourself to sometimes old-fashioned hospitals.
Interesting, thank you. And I was just thinking, in the pandemic, I mean, we're hearing a lot about mental health, more than we normally do, actually. And you were talking about the need to mainstream mental health. Could the pandemic, ironically, help us do that to some extent?
Yes, it will. It can help us. And what we see now is that all citizens, the whole population of Europe is now affected by the pandemic and also with mental health stress. So the old-fashioned way is that only people, only met people have mental health problems, and it's far away. It's not me. It's you. It's the other people. And what we see now in our group from all the members is that there is more attention that you can be affected by emotional problems caused by a problem outside, from outside. And so I think there's more awareness that everybody is on the mental health also vulnerable. And that's, I think, the most important thing that we have to point out, to stress on, that and that's also the side of the care. There is no health without mental health. So because mental health is very important for everybody. That's what I think the pandemic will bring us.
Okay, we haven't had any more questions sent in, but I have one of my own. I wanted to ask you, because obviously you're in the European field, and there is now a move to create more of a, let's say, a health union across Europe rather than overarching the member states. Do you think that will also help to create stronger policies for mental health in the future and make sure that they are adopted in each country?
Yeah, I think so. It's a long way, and that's also, I think, could be one of the points who come from the pandemic. That there is more attention for a sort of European healthcare approach. And so what we learn now from the pandemic, that we can't reach our goals with 28, 35 different ways to fight the virus. So there is now a way, I heard it also in Brussels, we have to take care of a bigger mental health approach for whole Europe. And what we try to achieve is that mental health is part of it.
Okay, well, thank you very much indeed. I'm afraid we're going to have to leave it there for the moment. If there are any more questions and we have time, hopefully we'll come back to you later at the end. Okay. And we're now going to zoom even further out to take a wider view of the international scenario for mental health with Afzal Jabed. He officially took over as president of the World Psychiatric Association this October, an organization that brings together more than 250,000 psychiatrists. Today, he's going to tell us what they think lies ahead for mental health in the coming months and years. Don't forget to send in your questions for him, as he'll be answering them straight after his speech. Jabed, the floor is now yours.
Okay, thank you very much. So during the next 10-12 minutes, I will just give you an overview. What are the challenges and opportunities for mental health, especially from World Psychiatric Association's perspective? Many of you know about WPA. As I said earlier, this is an association of national psychiatric societies and associations. We have got 145 member societies spanning in around 125 different countries and representing more than 250,000 psychiatrists from all over the globe. Coming back to the topic, mental health is really having an exciting times during the 21st century. We have moved our services from asylums to community and now to homes. There is an increasing awareness about mental health problems, and we are receiving a great acknowledgement of scientific, psychological, and social basis of many of our mental health disorders. But more importantly, this century is seeing an increasing awareness by patients, users, and caregivers in the treatment programs. Unfortunately, we all say that mental health is very vital and important. Even people give this slogan 1 in 4 or 1 in 5. The epidemiological data confirms that around 25 to 30% of global population suffer from one or another type of mental health problems. But it's a pity that more than 2/3 of people with mental illnesses receive no treatment. And undertreatment occurs in richest countries, but at the same time, it is more problematic in low and middle income countries. If we look at what have we failed to achieve over the last few centuries, first of all, mental health has not coming up as an essential component of health and social sectors in many countries. There is not enough clarity in professional roles and boundaries. Mental health has got a number of conceptual controversies. We are faced with uncertainties about treatment and prognosis. And we have always been having limited involvement of patients, users, carers, and families during the last couple of centuries. Now, just to give you one very interesting conceptual aspect, 21st century is the century of citizenship, century of social justice and rights for patients. But what happens? Have we achieved that? The second aspect is that who are the stakeholders when we talk about mental health problems? It has always been mentioned that professionals are important, but the reality is that patients, users, and carers are equally important. So based on these conceptual problems, what is the way forward? I think the time has come that we have to take the voice of our patients, families on board. We have to switch over from just treatment to psychosocial rehabilitation. Symptoms are important, but social functioning is even more important. We have to train the mental health professionals about the changing scenes and scenarios in the field of mental health. We have to promote a sense of confidence and sense of belonging to our patients, families, and carers. Mental health, unfortunately, has always been evaluated on perceptions. You look at the press, the media, the civil society, mental health is always linked to some difficult scenarios. I think what we need to do is that mental health needs to be evaluated on evidence, not on perception. And we have to promote that the service changes, whether they are at primary level, secondary level, at a society level, state level, or NGO level, these should be based on the needs of the population. And we always say that the policies should reflect as per the impact of the illnesses, problems that are associated with any specialty. It's a pity that mental health problems have got a high burden of disease, but we do not get share in terms of the budget, in terms of the policies, in terms of the service planning based on the burden of mental health diseases. And then there is a need that we have to improve the listening to users and to family members. The psychiatrist, the psychologist, the social workers need to have training. How can we involve our patients, users, and carers in the treatment programs? So based on that, very briefly, I will tell that what World Psychiatric Association is especially doing to achieve some of these objectives. Number one, we have established a group of patients, carers, and service users as our working group, as our advisory group. And we have taken the membership of this group from all continents. So we always approach them whenever we want to develop some policy or wherever we want the voice of patients and the users need to be highlighted. Second, we are involving patients, carers, and families in all our big congresses. Over the last couple of years, we have been having special sessions where the users, carers, and people from movements like Clubhouse movement are representing their viewpoints and sharing the knowledge with our professional colleagues. The third thing, coming to the CRPD issue, we really want that the concept and the images of dangerous and inhumane treatments given by the professionals should be corrected. We have established a group which is preparing guidelines about stopping coercion and helping our member associations to develop policies in this regard. So I personally feel that the movement by Clubhouse, whether this is Clubhouse Europe, whether this is Clubhouse International, is essential and very important for our joint collaboration. I really take this opportunity to invite both Clubhouse International and Clubhouse Europe to come forward and contact us for any joint activities, joint planning. We are not going to undermine any of the association. We want to supplement and complement the work which different organizations are doing. And we have achieved some milestones in this regard. WPA is collaborating with Fountain House New York to help and develop some curriculum which will be disseminated and promoted, especially for the mental health clinicians and workers. I personally believe that many training programs for psychiatrists do not have a component that could emphasize the importance of working with patients and carers. This is something which WPA really want to promote and propagate. I would certainly welcome any ideas from Clubhouse Europe, Clubhouse International, and Fountain House in terms of our joint work in the coming years. I always say that mental health has really witnessed a lot of problems externally, but more importantly, internally. We have to respect each other. We have to promote the dignity and the self-prominence of our patients. If we are not going to support them, if we are not going to provide help to our families, if we are not going to patronize their genuine and appropriate requests, I'm afraid no state will be able to listen to us. So this century, whereas it is giving us a number of opportunities and problems, that is also giving us some directions. And just looking at the recent pandemic, that has again emphasized that while the government, the societies are only talking about the general population in a very generic way, we are forgetting that a big number of general population is unfortunately that who suffer from mental disorders are neglected. So with this, I just finish my formal presentation, and I would certainly look forward having further interest, help, and support from the Clubhouse organizations.
Thank you so much, Afzal, and your contribution and thank you for your friendship. Mental health have to be more and more on the agenda of our politicians, of course, and a goal for our country's development policies on a worldwide scale. For instance, Clubhouse Europe and all our movement is working on the advocacy as a priority to create awareness on Clubhouse's methodology, and WPA is an important partner. Thank you.
Thank you. And I'm going to jump in because we already have some questions. Thank you for sending them in. One that I can answer myself, which was about the slides and if they will be available. That was from Sergey in Jerusalem. And yes, you will be able to access the slides afterwards. So thank you for that question. But Dr. Afzal, so this comes from the Norwegian coalition Fontenhaus Norge. And it says, do you have any idea how well-known Fountain House is among psychiatrists and psychological associations in Europe? How would you recommend that we introduce ourselves as a complement to treatment?
I think my answer would be very limited awareness about the importance of Fountain House or clubhouses among the psychiatrists or the professionals. And I think what I can offer from WPA, that if, for example, there are some services like Clubhouse or halfway houses in some countries, if they approach us, I will be more than happy to introduce them to our local psychiatric association. But I just want to add one thing, that many of you may not be aware that we established Fountain House in Pakistan about 50 years ago, and it is still coming up and working as Fountain House Lahore. So before many European countries were introduced to Fountain House concept, a low-income country like Pakistan adopted this model, and we are still pursuing and carrying on with that.
Oh, it's quite an inspiration, that. Interesting fact. I don't know if you knew that, Guido.
Oh, yes, of course, I knew that. It's a very famous clubhouse, and I'm very happy that in Pakistan you've been working on it for such a long time. So they must have a great experience. Okay. They are doing also a conference in 2021, I think. Are you, Asfal?
Yes, we are having a conference, and I don't want to put a commercial plug, but I will share the information with you, and let's hope that that will be another milestone. And again, not a commercial plug. The first international seminar on Fountain House model we organized in early 80s in collaboration with Fountain House, New York. That was in Lahore.
Okay, thank you. We have another couple of questions that I would like to go to immediately. One of them says, we have one Clubhouse model based on 38 standards. How to relate the great diversity in cultures, mental health policies, religions, and economics? That was quite a question for you.
Well, this is a very important area. And I think as we are going through this century, the topics and the concepts like this will gain more importance. I would certainly like to work on these issues through the help of clubhouses. And one of the milestone which I just mentioned, that Fountain House New York is proposing a curriculum, developing a curriculum, and WPA is a part of that, supporting Fountain House New York. And we feel that we can include all these topics in these curriculum or training programs.
Thank you.
Amanda, there is a question, what is the name of the Pakistan Clubhouse? The name is Fountain House.
Ah, there you are. Not too difficult.
Not too difficult.
I think you can remember that one.
Let me see that we have 37 standards actually. And I would like to say hello to our friends in Fountain House, New York. They might already woke up to hear us. I don't know, but I guess so. Okay. So what else?
We've got time for one more question.
Great.
And it's very interesting. Anita asks, she says, we're all very excited about the work that you're doing with Fountain House to ensure the Clubhouse approach is included in the compendium to for professionals. But Anita's curious to know if how clubhouses can also reach families that you were talking about in your presentation.
Well, I think this is very important. And I tell you, and this is without any bias, if the mental health professionals, especially psychiatrists, psychologists, doctors, if they promote this idea of involvement of family, that will have a greater impact. And my personal suggestion would be that you people are experts in these areas. You give us some guidelines, and I will ensure that we promote those guidelines, ideas, recommendations to our psychiatrists.
Okay, thank you very much indeed. I'm afraid we're going to have to leave it there. Possibly we may be able to come back to you, but I doubt it, given that we're at the time we are now. Excuse me. Our final speaker in this session is going to focus more on the future from the perspective of Clubhouse Europe. We're first going to have a recorded presentation from Clubhouse Europe board member Pauli Loija, filmed in the Helsinki Clubhouse in Finland. And then he's going to be back live to answer the questions that you send in. So please do send them in via the chat right now as you're listening to the video. So let's hear how Pauli Loija views the possible mental health scenarios ahead.
Welcome to Helsinki Clubhouse, Finland, where I have been a member since 2007, over 13 years ago. My name is Pauli Loija, and I have a bipolar disorder, as well as some other serious diseases. When I first came to the Helsinki Clubhouse, I was totally incapacitated because of my mental health problems. I had to stop regular work, and I thought that every door ahead of me would be closed. At first, that's how it looked, but already in 2009, I had an opportunity to participate in the Clubhouse International World Seminar in Florida, and there I gave a speech in one of the plenaries. I noticed that Clubhouse had given me a huge opportunity and could provide even more opportunities. I was asked to join the board of the European Partnership for Clubhouse Development, EPCD, which later changed its name to Clubhouse Europe, and of which I am still a board member. I don't even know how many years. I have also been involved in Clubhouse International work, of which I recorded 2 plenary speeches in Clubhouse International seminars, and also in a couple of workshops. Memorable big moments have been participation in the WHO Mental Health Gap conferences in Geneva, together with the chair of the Clubhouse Europe board, Van der Reitsma, where I could talk about Clubhouse model to total strangers, and where I noticed very quickly that I was the only expert by experience, the only person who had experienced mental illness. In too many conferences, the so-called specialists are talking about mental illnesses to other specialists, civil servants, and politicians. The general belief is that doctors and other civil servants are the best experts to talk about mental illnesses. I think the background of this kind of thinking is the assumption that people with mental illness are too weak or even too stupid to talk about the subject that they are themselves suffering from. The worst thing about all this is that while specialists are talking among themselves, people with mental illnesses do not hear what they are saying, nor are they given an opportunity to contribute. I'm glad about the Clubhouse model because it takes people with mental illness into consideration and includes their input. We are not just people with mental illnesses. We work side by side on an equal basis with professionals and Clubhouse staff. We are able to choose the way we use the Clubhouse and the staff with whom we work, giving us the possibility to engage in meaningful work in areas that interest us. The ideology of Clubhouses is based on equality. Also, at least here in Finland, Clubhouse members are deciding on Clubhouse work together with professionals, civil servants, and staff. We are also in the process of deciding Clubhouse work resources. For example, I have had an opportunity to talk to Finnish parliamentarians in the Finnish parliament about Clubhouses and the Clubhouse model, together with our Clubhouse director. There were also other associations talking about their subjects to parliamentarians, but I was the only expert by experience. When our European Clubhouse network expands, every new Clubhouse needs support from more experienced Clubhouses, and of course from Clubhouse Europe too. We need to remind politicians in every country about Clubhouse model's effectiveness in the rehabilitation of people with mental health problems. Experts by experience, people with history of mental illness, are in a key position for that work. Who knows better what it is like to live with mental health problems than people with mental illness themselves? Who knows better how the Clubhouse model has been instrumental and the key to their rehabilitation than those who have experienced it? That voice needs to be heard more at European and international Clubhouse policy level. We need to be more aware of the value of sending members, experts by experience, to important meetings where the resources for Clubhouse work are being decided. We need to demonstrate the positive impact that clubhouses have in conferences by providing real cases, real living people, and testimonials on how Clubhouse has helped them with their mental health problems. By providing opportunities and openness to members' voices in Clubhouse's international and foreign policy, it's the only way to show how Clubhouses have worked and succeeded. Clubhouse staff and board of directors needs to be more aware of the value and impact of the members' voice in external and high-level meetings, and should be encouraging members to participate in these meetings. It's not enough that members only speak to other Clubhouse members and staff in local and international Clubhouse seminars. We need to take the voice of the experts by experience, the Clubhouse members themselves, to all stakeholders meetings far and wide and at all levels. A member's testimony has always been the most powerful voice. We must not forget this. Well, it's been over 13 years. Why such a long time? What has Clubhouse given to me during all these years? Not only my own Clubhouse, but Clubhouse Europe and Clubhouse International too. Empowerment and rehabilitation, yes. Transitional employment, yes. Support to independent part-time work, yes. Big steps and great progress in my way of living during these years. And also, last but not least, all the positions of responsibility at the board of Clubhouse Europe and the Clubhouse International faculty. I have also had some opportunities to be an example of a Clubhouse member when Clubhouses has implemented its foreign policy. After all these many years in the board of Clubhouse Europe and Clubhouse International faculty, my message to all of you, members, staff, civil servants, and members of board of directors is: be proud of what we have in our hands. It is a piece of gold, and I mean this about the Clubhouse model. Be proud of the Clubhouse members who actually create Clubhouses and their success. Every member in the Clubhouse is a success story in their own right. I have tried to do my best in this area. I feel I have succeeded only a little in this area. But now it is time for me to take a step back. In the beginning, I mentioned that I also have some other serious illnesses too. Serious cancer has lowered my condition. But at the same time, I'm glad that there are some new members who are interested in joining the board of Clubhouse Europe. New member voices for the European and international field. Let's wish all the best to them, and also to all the members in European Clubhouses.
Thank you so much, Pauli, for your great support as an expert and as a board member. As you said, you are leaving the board. And please let me thank you with my heart for all you've done in favor of our movement and of Clubhouse Europe. I was the past chair of the advocacy group of Clubhouse Europe, and I really had the chance to appreciate your help, especially to coordinate our newsletter that, as a matter of fact, you created in a very professional way, in a very better condition to express our ideas. Thank you so much, Pauli.
Thank you. And we're still waiting for some questions to come in, but I thought I would certainly say to you something that came in from Wanda. You are my hero, Pauli. So I hopefully you enjoy that message. I was really struck by what you were talking about in your speech about experts by experience. And in fact, the field of mental health is not the only one to have this problem where you have experts talking to each other who don't necessarily have experience. How do you think we can encourage more people, as you've said, to participate, to go to all stakeholders meetings, not just into things within the Clubhouse themselves?
Well, the main thing is training members to have enough possibilities and encouraging them more. But as I said first, training. There are in Finland at least training programs, many kind of training programs for experts by experiences in different illnesses and also psychic illnesses too. And experts by experiences have been working here in hospitals now a couple of years. So
a model to certainly expand. Are you passing on information about that? I'm sure you are.
Excuse me, what was the question?
Are you showing other countries how to train people? So, as you were talking about, is this model going to expand?
Training program is, well, I don't know if there are other training in other countries training programs like we have. Perhaps I have to make a training program in English. At least I have to make a training program, new training program for clubhouses, for clubhouse members, and in Finland, and perhaps I have to translate it in English too. But it takes time.
It does, but it sounds like a wonderful initiative, and it would be good to do. Now, we have a question from Anita, who says, who also has a message for you. Thank you so much for your hard work and your moving speech. We are many people valuing the work you do, and we hope you're planning to be involved, even though you're stepping down from the board. Perhaps you could be doing this translation of this training as we were talking about. But the question is, what advice do you have to members who want to become involved in international work?
Well, so-called specialists, professionals have to be open, more open, to give them space give us space to speak, just like you gave space for me here to speak my message. There are not only testimonials we can speak also other kind of things, just like I talked today. So we must have more space, open space to have voice to be heard.
Okay, thank you.
Hopefully you can understand my
Yes.
English.
Oh yes, your English is very good. It's very impressive, frankly, and I think it's very strong that you're saying you need more space to express yourselves and to talk about things. We have one final question from Sergey in Jerusalem, who he says, "Please, Pauli, my friend, can you tell us your thoughts on the role and value of training bases, as well as the accreditation process?" So we're getting down into the detail here.
Value of training bases. Our clubhouse is working as a training base, and their value is very important. In our clubhouse, members are very important role in training 2 or 3 week trainings, and not only staff members or other professionals. So I cannot say anything more for this.
Okay, at least at the moment, hopefully, even though you're stepping down from the board, you will think about that idea of doing that training program. And that means you could leave even more of your mark as an expert with experience on the whole Clubhouse movement. Thank you for that. I'm afraid.
Yes, I think it's time to take a break again for lunch. So please stay connected. We will be back in about an hour at exactly at 1 o'clock in the afternoon. So see you in about an hour. Ciao.
Buon appetito.
Good appetite. Yes.